Okay, hi guys. Well, my name is Maggie. I'm the International Patient Coordinator at Prisma Dental. It's a dental clinic here in Costa Rica. I'm going to tell you a little about our services here. As you might know, our Costa Rica dental services here in Costa Rica are from 60 to 60% more affordable than the US and Canada. So a lot of US residents or even travelers come over to have their dental treatment here, okay? So let me tell you a little bit more, and we're gonna play a game at the end, okay? So I'm gonna try to keep you guys awake, okay?
All right.
Try with me, okay? I know it's hard. It's Friday. It's Friday. Okay. Well, our clinic actually have a pretty big staff. We are over 4 full-time doctors at our clinic. 6 hygienists, 2 clerks, myself, a patient coordinator. Everyone speaks English. Some Hebrew, some French, some Italian, really varies. But everyone is there to help you guys. Anyone, really. And since we have a really big staff, we actually have great availability. We work Monday through Friday, full schedule from 8 to 8 p.m. And that's why we are able to complete all our dental procedures and everything within time. We are international certified and awarded not only here in Costa Rica but internationally. In the US by the ADA, quadruple ASF, which are hospital standards, okay? ICOI for implants, AACD, which is Cosmetic Dentistry Association, and many others. We try to keep up with everything that's out in the market and up in our standards with everything that comes by. This is the way we keep everything up to date and the best way possible. We actually have a state-of-the-art on-site lab right there at our facilities, okay? So that gives us the ability not only to verify the quality of the material, but have our dentist and the patient, work with the technician. So all the works are supervised by our own doctors. That way we ensure the quality of the work, that the patient is not only, happy, but really satisfied with it. And we try to keep everything as possible, as good as possible. Here in Costa Rica, we don't accept, or we don't have, let's say, a dental insurance within the country. So if you have Aetna, Delta Dental, or any of this, MedLife, what we can do is we fill all your insurance documents so that you guys, once you pay out of pocket, you can get a reimbursement. It will cover the same as if in the US. So if your policy says 50% of a crown, it will cover 50% of a crown here. It's the same way. Now, as I said before, we are a big facility, so we work from preventive work, simple things, cleanings, fillings, whitening, laser whitening, to big procedures, oral surgeries, wisdom tooth extractions, implants, and many more. I'm going to show you a few before and after cases. Some are a little tricky to see because I know, before teeth are, when they come over to the clinic, it's because they have their teeth in a really bad shape. So try to bear with me. I know it's a little shocking, but that way I can maybe wake you guys up. Maybe? Yeah? Okay. So here are some before and after cases. We usually work different procedures depending on what they want. A full mouth restoration involves many procedures, okay? So it means just a complete restoration from left to right, from top to bottom, the whole 9 yards. In this case, we did root canals, post and core buildups, and zirconium crowns. It's a big difference how everyone looks at the end. If you initially have, longer teeth, but you want them shorter at the end, it can be arranged with our lab. If you want them not white enough, but more natural looking, it can be arranged. There's a whole broad branch of options. Now, this full mouth restoration involves dressing, fillings, deep cleaning, laser whitening, and zirconium crowns. Now, this mixture between laser and zirconium, it's basically we just place, for example, the crowns on top, but the person didn't want anything done on the bottom more than just to match the color. So we do laser whitening to match the color, okay? This particular case is one of our our highlights of the year. She's from Georgia, that's what I remember. She had root canals, post and core buildups, dental implants, and zirconium crowns. Now the dental implant she placed where she had the missing teeth, and the zirconium comes on top of her natural teeth, okay? The ones that were salvageable. Okay? Now here are just some changes of natural teeth with cover of crowns. Here's a mixture between pure porcelain crown and metal crowns. Now there are a whole broad option of materials that you can use. There's emax, ceramic, porcelain, porcelain with metal, zirconium. So it really varies on what your aesthetic and what you want it to be, and what the doctor would recommend in your particular case. Okay? Because some are a little stronger, some are a little more, let's say, aesthetic or easy to cover with the color that you want. Really varies. Now here's a case of before and after with just zirconium crowns. Okay? As you can see, just a simple change like this that they have right here is a big change to their smile. Okay? Now, a single dental implant. Most people wonder what it looks like. Okay? A dental implant is never seen naturally. It goes underneath the gum line and underneath the bone. Okay, so no one would ever see your screw. It's like when they put you a hip or a pin at the knee. No one ever knows unless you tell them. Okay? And what they do see is the crown at the end, which is the result. They just figure it's one of the natural teeth. It would never show any difference. Okay, here's mixture between crowns and laser whitening. This is the mixture I was talking about. Sometimes you just want the top or the bottom, and the way to match the colors to what you desire would be to do laser whitening as well. Laser whitening is a really simple procedure, and it helps a lot. It is done in one single session, or I'm sorry, one single appointment. It's a few sessions in one appointment. So it's like 45 to an hour. It's not long. It's really good. I've done it. Okay. So here is implant supported dentures. Now these are the big cases where patients need to have all their teeth removed, or they already have a lot of missing teeth. They just have, I don't know, 2 or 3 left, and they want the whole smile new. Okay. In this case, what we do, in this particular case, what we do is we place 6 dental implants, okay, like 3 on each side, to support a bridge, which is a whole porcelain bridge or zirconium bridge on top of those. Now, since there are 6, we are able to do them screwed, which means permanent, not removing them at the end of the day, not washing them out, just going to a regular dentist appointment every 6 to 8 months, okay? We recommend 6, but I know it's almost impossible sometimes with time, traveling, and the whole thing, so it's the best way to go, if possible. Now, the difference between this one and what we'll see next is the amount of implants placed, and this usually varies patient to patient, depending on what their bone is at that particular moment of the placement. Okay? So this is a all-on-4 dental procedure, which is where we place just 4 dental implants, like 2 on 2, and we put a denture, which is like the removable dentures. It's an upgrade of the removable dentures that you guys usually know about, which is where they are supported by those implants, which means it doesn't wiggle. It doesn't move out when you talk. It and doesn't have a palate. Okay. Now this is a case where we do an all-on-6 on top and an all-on-4 on bottom. Okay. Now the top, in this case, he wouldn't need to remove it, wash it out, or anything. The bottom once a day, at the end of the day, and there's no problem at all. Okay. I know it's a little creepy. Try not to. Okay. Now, here are just a few, let's say,